Hello. Thank you for clicking on this link. I'm Dan Pfister, and this is Healthcare Conversations. Today's guest is Dr. Brent Burkey from Fisher-Titus Health.
Fisher-Titus is an independent, not-for-profit community health system that provides care for the 70,000 residents of Norwalk, Huron County, and North Central Ohio. The medical center includes a 99-bed acute care hospital, 69-bed skilled nursing unit, a 48-bed assisted living facility, home health center, and outpatient services. Fisher-Titus has 1,300 employees, over 200 active medical staff members representing 35 medical specialties, and an amazing network of 175 volunteers that make the patient and visitor experience enjoyable. In 2010, Fisher-Titus implemented fully integrated all-digital smart rooms, integrating the electronic health record system and interactive technologies in patient rooms. Fisher-Titus has earned designation as one of the nation's most wired hospitals ever since 2012. Fisher-Titus is in the rural and community top 100 hospitals. It is a level 3 trauma center and a primary stroke center. Dr. Brent W. Burkey is president and CEO of Fisher-Titus Medical Center. Dr. Burkey began his career in healthcare as a hospitalist in the Cleveland Clinic's Department of Hospital Medicine. During his 14-year tenure at the clinic, Dr. Burkey held numerous leadership positions across a variety of disciplines including clinical, information technology, and operations. He was named Vice President of Medical Affairs at Cleveland Clinic Fairview Hospital in 2014 and as Chief Medical Officer at Cleveland Clinic Avon Hospital, and was instrumental in opening that newly constructed hospital in 2016. In February 2018, Dr. Burkey joined Fisher-Titus as President and CEO and manages hospital and medical center operations, quality, safety, and medical ancillary performance. Dr. Burkey's extensive operational medical experience provides a distinctive perspective of the challenges that physicians and community hospitals face in providing the highest quality of care to local communities.
But maybe I'd like to start off by just taking a few minutes and talk about like what happened to Fisher-Titus during the coronavirus. What were some of the impacts to you, your staff, and what was the effect on the community?
Here at Fisher-Titus, I actually just celebrated my 30th anniversary being the president and CEO of the organization, as we've now wrapped up 1 year into the coronavirus. And just 1 year ago, this month, is really when things got started in earnest with coronavirus. And about a year ago at this time, we really were really deep in the planning stages for what we anticipated to be a very busy late March into April, based on what some of those early projections were just a year ago, and what the rest of the country had been experiencing in very large cities and much larger urban populations. And where Fisher-Titus is located in North Central Ohio, we're not as densely populated and more of a smaller rural community. We did not see that initial surge. And that really gave us a slightly extended period of time to be able to plan and ensure that we were prepared both from our staff and community's educational needs around coronavirus and what was needed, as well as really implementing our workforce strategies and our operational strategies within our organization to then really prepare as we did start to see those significant uptick of coronavirus cases and individuals that required hospitalization. And I'll give you for instance, so last April and May, when we were required to cease elective procedures for a period of time to ensure there were enough supplies and enough employees in the workforce to care for patients that required hospitalization. During that time, we did stop elective procedures, and it was very important for us in our community, in a smaller community. It was very important for us to ensure that our staff continued to have work. And so we did have those surgical and procedural nurses and employees who provided care for patients in those areas. They did go through processes to become oriented to provide care in other care settings, be it in the inpatient setting and other areas that we may need to have provide care for that influx of corona patients. Luckily, we did not see that as earlier as early as in other larger populated cities, Dan. But it allowed us time to prepare for that. Also, early on, it allowed us from a supply perspective to make the necessary preparations. And we considered all sorts of avenues. Ventilators and ventilator supplies, for example, were a very large topic of interest. Things of how many patients would we be able to have receive ventilator support off of one ventilator if we had the surge of patients that were expected in our area. We tried to ensure that we had the right products and supplies to support the ventilators. And we looked at various things in our community, which is heavily based in manufacturing and other VOTEC schools. And so we went to our community and said, how could you, if we can't source certain products, how could you help us make it?
Right.
And this part of North Central Ohio is actually very well known for supplying parts in the auto industry. And so we did go out to some of our technical schools and local manufacturers, asking if we could make and manufacture a 3D print, for instance, filters and different parts and components for ventilators, and really went back to our community and said, how can we all pull together and support what's needed to support our community and obviously our patients and our employees, and working together in the fight against coronavirus. And that was just a year ago. It seemed like it was much longer now, but those are some of the examples of where we really tried to pull together our workforce, our community, and then the resources, the manufacturing capabilities in our community to help support the fight against coronavirus.
Can I ask you just, since supply chain topics are near and dear to my heart, but I think one of the big things that healthcare systems identified as coming out of the pandemic issues, this idea that the supply chain was global, that all of a sudden nobody could get PPE supplies because they all come from China. Are you, as you speaking with your vendors, as you're looking ahead for maybe like the next pandemic or even some natural disaster, does product being in country matter more to you now than having like a global supply chain where maybe you get a better price break, for things that are manufactured offshore, but they're just not available locally? And are you working with your vendors to, make sure that this type of impact doesn't happen again?
Yep, absolutely, and definitely to a certain degree, we are looking both at where things are sourced, from, Dan, and then also working with our various vendors and supply chain, understanding what's the capacity within the supply chain. So while we may not want to increase our stock or our carrying cost within our organization, especially being a small organization,
sure,
we have to be mindful of our resources, but understanding what's the capacity of the organizations, the supply chain organizations we work with, the vendors behind us, and what's their capacity. Throughout this, we also worked with 3 other local independent hospitals in North Central Ohio to aggregate both from a purchasing power perspective and also to look at how we may load balance our supplies and what each one of the 4 hospitals of us together may be able to help one another. So if one of the hospitals were more critical need in one area, we were able to look at what our inbound supplies were and be able to load balance each other and share and then overall meet the demands and needs. And then we also looked at how we could aggregate together where we had commonality and to be able to order product together as well. And that helped fend off a little bit for us. The demand during the pandemic. From a future looking perspective, it becomes tough because this was a once in a lifetime or once in a century event.
Right.
And I think that's some of the difficulty that the industry in general ran into, which is from a day-to-day in a normal operating world, in a normal operations day-to-day, it's hard to plan for that once in a century event.
Sure.
Because it's just that. And the expense of that and the expense ultimately that adds to the cost of healthcare, that's something in the long run is not sustainable. But how do you have adequate supplies, or on a demand basis, how are we able to call up and retrieve additional supplies?
Sure.
I think I think some of
Yeah.
the other lessons learned, we within our organization, we also work with our regional hospital council,
Mhm.
and they did have a cache of supplies and various inventory of items needed for disasters and other occurrences. The maintenance and how to maintain those supplies was also a concern that came up early. Of are those things stored in conditioned space?
Right.
Is that stock rotated appropriately? If you're working with a regional coalition of partners,
Right.
how does that how do you maintain that inventory and that stock and to make sure that it is usable in a time of need? And I think
Right.
those are some lessons learned that yes, the material of the mask may work or the expiration date of the mask is still good, but if, for example, if N95 mask was in unconditioned space subject to the extreme heat or the summertime heat or wintertime cold, the product was still good, but maybe the rubber band or strapping on it wasn't, and that deteriorated and then made it more difficult to use the product. Things like that were some other lessons that we learned out of this as a region.
How about your staff? Just like the frontline workers, everyone coming in every day dealing with it. That no one in healthcare got a break. How did your staff respond to the pressure of the pandemic, and you as a leader, how did you hold it all together?
Sure. Well, first and foremost, our staff did a phenomenal job, Dan. They were there. They were there shoulder to shoulder from day one. They also had the same fears and the same concerns that we all had as individuals of what does this mean? What does this mean for me individually, and what does this mean for my family? And the fear of being in a work environment that always has some sort of potential for infection or handling and working with infectious individuals. But with the extent of COVID, that fear always existed with our workforce, and the fear of taking that home
Right.
to children, to elderly family members that perhaps live with staff, and that was a real fear and anxiety producing situation for many of our staff. And we worked really hard to communicate with our staff around how we can keep them safe, the use of personal protective equipment, the rationale behind that, how we followed CDC guidelines and how those evolved as we as a society learn more about the virus itself, and as PPE requirements evolved and changed over the duration of the pandemic. Um, those were very crucial conversations for our staff to understand when we needed to ramp up protection and when we were able to slightly reduce protection as we now move into more of a vaccinated healthcare workforce and ultimately a vaccinated general population. But those are very scary situations. We also saw an extreme amount of gratitude and outpouring of support from our community, where we would have local, local social and civic organizations that showed up and said, "How can we deliver, food for the night shift, or how can we deliver
Wow.
food for the ICU nurses?" And we ultimately had a coordinated way in which to do that because our community the outpouring of support from our community for all of our healthcare workers, and that it was great to see and great to be part of that. But it was a lot. There were a lot of difficult months there, Dan, to balance the fear and the unknown and the anxiety, along with the reality of taking care of patients and providing the care we needed in our community.
I know everything always rises in an organization to the highest level, but through the huddles and through the staff communications, I mean, did all that fear, that pressure, that internal stress end up on your desk?
Well, it ended up on a lot of people's desk. We were all part of it. We work as a team.
Sure.
Our leaders really pulled together as well, Dan. As we stood up our hospital incident command, and we still have that going today.
Oh, wow.
That was something we very quickly realized was not a few month ordeal.
Huh.
We are as I mentioned, our hospital incident command is still running to this day on a reduced frequency, but we still
Right.
have a weekly incident command structure that we report out and communicate within our organization. Those leaders during those very busy early months, it was a 24/7 staffed operation, and our vice presidents and our directors manned that, and they were here and in-house, shoulder to shoulder with all of our frontline employees during those heavy days of the pandemic. And there were so many questions that um, were just new and challenged how we as an organization respond to the questions that our employees and patients had. What happened in certain exposure situations? What happened? What happens with staffing? What happens if supplies run short or in low, or in high demand, and are we able to get it just in time if we need a certain product?
Right.
Uh, as new modalities of treatment were introduced, from various medications for use in COVID treatment, to the monoclonal antibodies, and now even
Right.
to the vaccine. Every time something new was introduced, um, it created the need to develop a new operational playbook and clinical playbook of how to implement it, how to process that change, really in a rapid in a rapid succession need to implement all that for our patients, and how to coordinate it not just at Fisher-Titus, but how to coordinate it with our partner hospitals in North Central Ohio, then ultimately how to partner with the other larger academic centers across Northern Ohio should we need to transfer patients out if we ran out of bed capacity.
Mm.
And so there was just a multi-layered approach of working and maintaining things locally at Fisher-Titus within our region, and then within Ohio, they call it within the super region, which was essentially the tier across all of Northern Ohio from Cleveland to the Toledo area.
So that's amazing. I mean, and like you say, so in effect that while it's toned down a little bit, but you're still in crisis mode. You can't take your eye off the prize yet.
Oh, absolutely. Yeah. No, and it's a different type of crisis mode.
Right.
I would say it's a happier crisis mode. And, as some of my colleagues have said, at least now we're talking about how to distribute vaccine. That's much better. That's a happier place for all of us to be in healthcare than to talk about how are we treating patients, and do we have enough beds today, and do we have enough ventilators?
Right.
Much better to be talking about how are we going to push a certain amount of vaccine out to the public this week versus next week. Much better conversation, much better clinical conversation to be having. But it does bring new challenges in terms of just operational challenges between the vaccines as they get approved. As we really at this point only know our weekly vaccine allocations on a week by week basis, that creates its own inherent staffing challenges of days of public clinics that need to be ran for vaccinations, the staffing challenges and needs to come along with that, and then also meeting our public's expectations and desires, where we have a large percentage of the population that wish to be vaccinated with a scarce resource of a vaccine, and now 3 vaccines available.
Right.
And making that available to them, we've met that challenge to distribute the vaccine we've received. Still not quite enough to meet the demand in our area.
Yeah, it's like you said. I mean, every new wrinkle in the problem creates logistical and operational challenges that the organization has to ramp up, solution, figure out, and implement yesterday.
Absolutely, I really do have to give kudos to the amount of regulatory red tape that's been lifted for us in healthcare around this. That has been something that has been necessary, not just during a pandemic time,
right,
but it's something that has really allowed us to move quicker and faster to implement things for our patients and our communities. Unfortunately, those things still do take time. There still are certain regulatory and compliance matters that we have to be sensitive to. There's IT infrastructure and build when we roll these things out, and to make sure that we still have that integrity within our healthcare system, that what we're doing, we're capturing, whether it's from a patient record perspective, collecting the right vaccine information and data, and the requirements then, in some of these instances, then there have been additional reporting requirements that we also have to get back both to state and federal agencies. And we need to make sure that we have that data integrity and infrastructure in place to meet those new expectations as well. So it's quite an effort all the way around.
That's actually kind of a good segue in terms of one of the things that Fisher-Titus is known for is its electronic health medical records, the digital smart rooms. And I know that one of the challenges of coronavirus was that the patient record had to accommodate things that, fields and modalities that had not been in the technology and the platforms before. Could you talk a little bit about the technological changes that you had to bring into your platform, the platform that you have that you're well known for, that you've been recognized for, and maybe a tie into that. What effect did telemedicine have as well into the Fisher-Titus response?
Sure, no, absolutely, Dan. The introduction of telehealth services had been on our roadmap in 2020 and just had not been quite timed the way that it ended up occurring with the coronavirus. That really gave us the accelerator to move much quicker and faster with telehealth implementation within our system. And with the changing of the restrictions around telehealth and what constitutes a telehealth visit, we were rapidly able to convert and provide those services with a video visit for our patients in our ambulatory clinics, while we work simultaneously on a more formal process for rollout of the telehealth work. And we now have that available on demand as well as in a scheduled format. What also we've been able to do with that bundle is provide a whole host of other digital services to improve access for our patients to our healthcare, and also to make that interaction easier. So concurrently, we also have rolled out patient self-scheduling availability, both for inpatient and telehealth appointments across our outpatient clinics. We've also leveraged some of that self-scheduling capability now in our long-term senior care facilities to allow patients' family members to schedule that self-visitation, because there are regulatory requirements around that of when a patient in a long-term skilled nursing setting, for example, how and when they can have visitors. So we've leveraged some of that technology to allow that patient and visitor interaction to occur much more smoothly. And then ultimately, we're looking at how that technology can work for us, and with some of the initiatives that the state of Ohio have going on around a common vaccine scheduling platform, and how that may interact to ease patient scheduling into vaccine availability, and then ultimately how that integrates in with our system, our EMR system as well going forward. As I mentioned earlier, it also produces challenges, and has challenged some of the traditional ways that we exchange data with some of our partners. And we've worked at a state level, and are working currently as this week with some of our partners that within the state of Ohio to facilitate quicker, faster, and more real-time data exchange to provide more in-the-moment data that provides better real-time decision-making as well. And as I mentioned, we're doing that literally even this week as it relates to vaccine data, so that we can all make better decisions around quantities and vaccination status of our communities. So it's been quite fascinating.
The community that you serve, have they been able to embrace telemedicine? Is it a challenge for them to get just internet access, or are you having to do outreach to also educate the community on how to interact with you electronically?
It's been a mixed bag. So we have our community has a kind of a mixed a mixed scenario related to just the acceptance of the telemedicine, Dan. Our pediatrics practice, for example, was the first to go live with some of the televisits. Really embraced. We were able to offer extended hours, mornings and evenings, and even into the weekends, and that was really well embraced, especially for well visits, which at a period of time were much more easily performed telehealth versus in person. And I think for our older patient population, it certainly does provide some technical challenges. But at the same time, in our community, for that population that is technologically savvy, they may also have a transportation challenge. So the very interesting thing is, for some of our patients, if they had a transportation challenge but were technology enabled, it actually was a win for them.
Right.
And then for other members of our community where they maybe were not had the technology access but had transportation, it was more of a boundary for them. So mixed bag, and we're trying to really find the right mix now of in-person and telehealth. Overall, will we have more telehealth visits than what we had pre-coronavirus? Sure, absolutely, we will. I think we have a few more months to go to understand really where that will fall out at, what our new baseline will be for some of our populations.
For your providers, your surgeons and physicians and medical office buildings, are they able to be more effective using telemedicine? And I would imagine that maybe just the routing and the scheduling and all that might be easier for them.
In certain instances, yes, I think they are finding the efficiencies in there, especially in certain types of care where it may be post-operative care and you want to check in with a patient. And as I mentioned, with some of our geography challenges in our communities, where that patient may not need to come back to be physically seen, that the telehealth is certainly an enabler there to have the physician or the surgeon and the patient have that point of contact and be able to see perhaps the surgical wound and to evaluate that without the patient physically coming into the office if they otherwise feel fine. That's been, I think, a positive. In other instances where you need to have a more physical, patient and physician interaction.
Sure, personal touch.
Personal touch. Still trying to sort through some of those things.
Yeah.
But we're definitely looking to push some of the traditional boundaries and acceptance in a smaller community of accepting telehealth and finding the right balance between personal touch and how do you deliver that personal touch telehealth versus an in-person visit, and what's the right frequency and cadence where maybe you're in a mixed model of some visits being in person and some visits being via telehealth as well.
So in the same regard of that, from like a virtual versus personal, in terms of your staff and maybe those departments that were able to work virtually, back office organizations and things like that, are you trying to find a mix as well in terms of in office and virtual?
Yeah, absolutely. Similar kind of things apply there, Dan. It's been kind of interesting. I think early on in kind of that new virtual workforce or working from home, I think there was a lot of trepidation early on of, oh my gosh, I don't know if I can do my work from home.
Right.
And then I think there was a certain level of comfort achieved of, hey, this really can work because I have everything I need with me. I have my computer, my desktop, and we have virtual Zoom type conference ability, and that works out okay. And I think people liked it for a period of time. I think the interesting thing now that we're starting to see a little bit is some people love it and are ready to continue working in that way and working remote. And I think some other folks are looking forward to being back and enjoying the collegiality of being, down the hall or, working a little bit more closely with their work colleague to be able to get out of the house, so to speak. So it's I think we're starting to see that differentiation. So I think we'll ultimately land in a hybrid model somewhere and or having a more flexible work schedule. where individuals may spend a certain amount of days or time physically on site or on campus, and then maybe a certain amount of time at home versus all virtual or all on site.
So again, that's a good segue, and I want to be conscious of your time. But all of that then, what's the new normal look like for you? And as a leader, what are maybe your short-term goals and objectives? Coming off of the pandemic, getting back to whatever new normal is, and then at the same time, I'm sure you have to have the long-term goals that you're working on for the hospital, for the community, and so could you just maybe talk about that a little bit?
Yep, sure, absolutely, and yep. So we, I guess whether short-term or long-term, we really we look at five key areas for us of importance, and as we look at our 5 areas of importance, we then look at what are our annual tactics, the short-term tactics, and then what are our a little bit, maybe broader or a little bit closer over the horizon type tactics. The 5 areas that we really look at are our patients, and around patient quality and patient experience, patient satisfaction. And we have the things that we need to work on the here and the now. And as we discussed a little bit, what is the patient experience in a new virtual telehealth world, and what do we want that to be, and what do we want that to be in an in-person experience as well. We also focus on our people, and as we've talked about already with our people, what does that new workforce and workplace look like? And so we're investing in some of our workplace efforts. We have some of our workforce that historically was not working out of the same location. So we are looking at plans to have some of our workforce come back together in a consolidated area that is more conscious of the space and the environment in which they're working in, given what we just went through with COVID.
Sure.
And then we also are looking at from a workforce perspective of investing in our people and ensuring that they are appropriately compensated and invested in as a workforce. Our people are without a doubt our most important asset. We also look at the access to healthcare, and in the short term, again, how does telehealth play a role into that? And do we have the right accessibility, no matter how someone wants to access us and when they want to access us? And that's where telehealth becomes vitally important, from an after hours or kind of maybe a non-standard time to interact with us or our organization. That also goes into different service lines. Over the last few years, we've crafted and created new partnerships with our trauma program, as well as introduced level 2 cardiac services in our community. And our patients, as a result of that, now don't have to travel an hour to a major metropolitan area to receive certain types of cardiac care. And providing that access to services in our community is very important to us. We also look at affordability, making sure that we as an organization are able to provide affordable healthcare and competitive healthcare for those in our community, and how we have our services as really a full service healthcare system, how we have our services pulled together to ensure that we have all of our parts of our organization working together in the most efficient and streamlined ways they can to be able to deliver that affordable care. And then community. The community is really the foundation that all of these things sit on top of, Dan. And how do we engage our community? How do we, as the largest employer in our county, how do we convey our investment in our community via employment of those working in healthcare at Fisher-Titus? And how do we give back to the community? And then also, how do we interact with the community for the community to understand the services we provide here and the importance of that community and organizational collaboration that's needed to ensure that the services are able to be here in the future. While we can't be everything to everyone, we can be a very, very rock solid community hospital and provide the majority of services that are needed from a healthcare perspective in the area we serve. And we also recognize that, patients will have to receive the highly specialized care, in other locations, but having the basis of that community partnership and foundation is very important to ensure that we keep, the majority of the types of services that we are providing today here in and available for our community for their accessibility as well.
What keeps you up at night the most? And at the same time, so what are you most worried about? And what are you most proud about at Fisher-Titus?
Sure. Well, I'm most proud of our people, Dan. Like as I mentioned, our people are our biggest asset. Our people, our workforce, they're in our community, by our community, and for our community. They're here every day. They come and they put their heart and soul into their work, because ultimately the individuals they're providing care for could be a friend, a neighbor, someone that they know in the community, and that's what drives them every day to do their best. And it's so admirable to be able to see that community and that connection together, where someone will just go to all lengths to be able to provide that level of support and outpouring back to their own community, and to be able to fight for them, fight for their health, and to fight for their health and wellness in the community is just it's so awesome to be able to see that and to be part of it. I think that's probably that's the proudest thing that it really impacts me every day when I see that, and I see it in the faces of all of our employees across our system. The things that keep me up at night, that list could be long, Dan. It could be many,
Yeah. I'm sure.
I do sleep well. I'll leave you with that. I think the biggest thing as an independent community hospital is really making sure that we as an organization, and myself as leading the organization through the decisions, to make sure that we're relevant, to make sure that we survive. And it's really because of that community connection, the longstanding community connection, and that the provision of services back to our community. That's something that is very important for me, for the organization, and for the organization's legacy, to make sure that we are making the decisions now as a leadership team and an administrative team, and that I have the honor of leading that, to make sure that we are making the right decisions day in and day out, to make sure that this organization, that Fisher-Titus, is relevant in this community and in the area, and for the patients that we serve, not for today, next week, or tomorrow, but for the years to come. That's really the biggest thing. If I had to say that what keeps me up at night, it's making sure that we have that ability to be relevant in the future as an independent healthcare system. It gets harder every day, but it's something that we're going to do, and that's my charge, and that's what by working together, that's what we absolutely will continue to accomplish.
Well, that's the good work, right? Is taking care of the patients. Yeah,
that's the good work, and it's the fun work every day. And
right.
There are many things and many plates to keep spinning day to day, but that's what keeps it interesting. That's what the challenge is, day in and day out. Those are the fun things to keep all the work interesting, Dan.
Yeah,
it really is. It can be daunting sometimes, but it's why you have good people and good team around you, and you make the right and best decisions you can at a moment in time. And if you have to correct them, you correct them and you move on, and you keep making headway down the field every day you can. So.
Well, I appreciate your time, Dr. Burkey, and I think I would. My last question might be, given the rough year, is there a vacation in store for Dr. Burkey this year? Is there a beach that you're going to lay on with a Mai Tai and a pina colada or anything like that?
Well, Dan, I do love to travel, and I like to expose my kids to different cultures and different things. So, yep, I definitely will find time and have plans to find time to get away from it all. As you know, we're never totally disconnected from our work.
Right.
Doesn't matter where we may physically be at, we're always connected, and that's part of it, and that's okay too. But definitely there are plans in the not too distant future to be able to take a little bit of a relaxing break as well.
Well, and I'm sure your tech guys could find you a satellite phone, so you will never be out of touch.
They do, but they also probably turn it off from time to time, Dan. Just to, they make sure that they also get a break as well.
Sure, yeah. Well, hopefully, when the world opens up for everybody will be able to breathe a little bit of sigh of relief coming off of what has been an incredibly challenging year for all health systems.
Oh, absolutely, yeah. No, I think everyone's looking forward to that. I think there's definitely some pent up demand, for folks to definitely do that, and it really has been just the amount of decisions, the volume of decisions, the pathways to take going forward that has been more challenging than really some of the what. It's just been the volume of things at every turn and every twist of how to react and how to respond more than the difficulty of any individual decision itself. And that's definitely been the load balancing of that has been, I think, a challenge for folks, over the last year. So,
wow. Yeah, just the flood, the overwhelming.
Stop.
I just wanted to thank you, Dr. Burkey, for your time. I really do appreciate it, and I hope it was worthwhile for you to share a little bit about Fisher-Titus.
Sure, absolutely, Dan. I appreciate it. No, I love doing these things. They're great. Anytime, happy to rejoin you at any time. Always
appreciate that.
Fisher-Titus and the great things we have going on here, and our great folks we have doing them here at Fisher as well, Dan. So absolutely delighted to be able to join you and have a little conversation, a little chat today.